Good morning. Thank you so much for having me here today. My name is Angela Shaba, and I am a licensed clinical and sports performance counselor here in Scottsdale, Arizona. My private practice is called Elite Psychology and Wellness, and I am really excited to be talking to you all today about mental health in female athletes. So just a few disclosures. I am a licensed clinical and performance counselor, like I said, and I am in private practice here in Scottsdale, Arizona. I am also a member of the SMAC committee, which is a Sports Medicine Advisory Committee, and that's connected to the Arizona Interscholastic Association. We develop best practices for our youth athletes here in Arizona. And just today, we're going to be talking about best practices for mental health in our athletes. But by no means does anything that I'm saying actually reflect any specific crisis or mental health procedures specific to a school district or a university or an institution. So always check with the place that you work with just to make sure of the specific safety plans that are in place at that employment. Okay, so what are we learning today? So first of all, we're going to identify overall mental health, right? And specific mental health issues in female athletes. We're also going to learn the signs of mental health distress in female athletes, and then also learn how to support your female athletes when a mental health situation arises. I also want to give you some specific tools and resources that you can use to help collaborate with others and also help your athletes. Okay, so take a look at this picture here. I want you to think a little bit about what do these athletes have in common? They are Olympic athletes, they are female athletes, but more importantly, what I want to bring to your attention is that all of these athletes actually have struggled with mental health issues. They are also been very vocal in the media and publicly have talked a lot about these struggles. So it's really, really cool to start to hear how athletes, especially professional and Olympic athletes, are bringing awareness to mental health issues in the athlete population, especially the female population, to reduce the stigma associated with getting support and getting help when a mental health issue arises. Okay, so let's talk about mental health in athletes. So what is our mental health? Our mental health is our emotional, our psychological, and our social well-being. It affects the way that we handle stress, it affects the way that we handle life's challenges, and also the interactions that we have. So increased demands actually increase stress, and that creates our mental health and emotional challenges. So here is a slide about just some statistics that are relevant to youth in Arizona and adults in Arizona, but also in the nationally in the United States, and how Arizona compares to the national level. So I'm not going to talk too much about all of these statistics or go through all of them, but one of the things I want you to look at is to notice that we are seeing a lot of Arizona youth, a lot of Arizona adults who are struggling with mental health issues and who have even been diagnosed with a mental health issue, but who are not seeking help, right? And so 41% of Arizona youth reported feeling sad or hopeless compared to the national level at 37%, but only 58% of Arizona youth received care for depression. So we have a lot of people who are struggling with mental health, but we don't have the support or maybe the awareness or the help that they may need to get to a licensed professional and to help support them through these challenges. So I think everyone knows who this is. This is Serena Williams, and she's quoted by saying, "Let me know that my feelings are totally normal." Serena Williams has been very open publicly about her struggles with depression, and most notably and most recently her struggles with postpartum depression after she had her first child. It's really, really great to see a professional athlete like Serena Williams, who has so many accolades and is so well known in the community, to actually be talking about something that is very personal that she struggled with, so that other people can understand it's okay and that they can also get some help. So this leads me to start talking a little bit about are female athletes and mental health in our female athletes. So female athletes are actually 2 times more likely to develop depression, anxiety, or an eating disorder. They're also 2 times more likely to have an eating disorder than the actual general population. Injury can create increased body image issues, and eating disorders can develop. Most athletes in general, when they get injured, they can have a lot of depressive and anxious mood, and also can kind of have some mental health struggles, more so than when they're not injured. But females have a tendency to also not only experience depression and anxiety, but also start to have more body image issues, and then develop some disordered eating patterns. Okay, so a recent survey from the NCAA just came out in 2021. These are some statistics that I think are really good to just kind of keep in mind, and also just to shed light on the gender differences that we're seeing between female athletes and male athletes. So overall, this survey found out that female athletes reported more mental exhaustion, anxiety, and depression than their male peers. 47% of women reported feeling overwhelmed, compared to 25% of men. And 29% of women reported feeling overwhelming anxiety versus only 12% of men. So we are seeing disparities in terms of how much mental distress women and female athletes are experiencing over their male counterparts. So why the difference, right? What's going on? Why are we seeing differences with females versus male athletes? So in general, in the general population, females are just more likely to have depression and anxiety than males. So that is probably why we're seeing more of depression and anxiety in female athletes in general. Females in general are also more likely to express their emotions. They're also more likely to talk about things and want to speak about things openly and externally, like process things, and are also more likely to seek out mental health support. So going to therapy is not as stigmatized or as taboo for a female to do than it is for a male. So I think those are some things that we definitely see in the general population that we're also seeing in the female athlete population. On a flip side, since females are able to, be more open about their mental health, maybe we are also, they're self-reporting more, so that could also be why we're seeing such high statistics. Females also just get bombarded a lot more with body image messages. They can get bombarded with social media messages or societal messages as to how they're supposed to look and what they're supposed to be looking like. And I think that those messages are also being given sometimes from the coaches or from the team, and relates to their performance. If you look this way, you may perform better at your sport. Females also have a tendency to think more about other things than just their sport. So they're thinking about, relationships or their future plans. Maybe they're not thinking about going pro or playing internationally. So they're basically starting to think about who they are and what does that mean in terms of where they are now with their sport and how they're going to get where they want and need to go. And that kind of starts to create some anxiety, some stress, and some pressure, right? Also, there's pressures to be connected to people socially and romantically, and what does that mean to them? And that also can start creating a lot of anxiety and depression. Hormones is something I think is important for us to just talk about when we're talking about females, and that I do work with a lot of female athletes who talk a lot about during a month their mood can dip up and down, and so it's super important to kind of, I think, as professionals and practitioners who are working with female athletes, to keep that in mind. Also, there's a team culture that I see a lot more frequently with female sports teams than I do with male teams. Sometimes there's this mean girl environment, and everybody's sort of competing with each other, and there's not a lot of support. I see this a lot with copycatting with disordered eating. So they're sitting around at a table at a team dinner, and someone's not eating, or someone's watching what they're eating, and then they are seeing them perform well, and so they start thinking that maybe that's exactly what I should do. And so instead of cultivating a positive environment, we're sort of cultivating more of a negative, more mental health environment. So segueing into that, what do I really see in my practice with my female athletes? I see a ton of anxiety. I see a lot of depression. I also see a lot of body image, and I do see and work with people who have eating disorders or who have just been sent out of an eating disorder facility and really trying to work through reintegrating back into their environment after getting the coping skills that they need. One of the things that's so important that we don't talk about a lot, because we talk a lot about anxiety and depression, is burnout. I see a lot of burnout with female athletes, a lot of feelings around, again, identity and loss and mental exhaustion, feeling like I have so much going on and so much responsibility, and I don't know where to go, or even if I want to continue with my sport. And so that's a huge point of conversation that I'm always working with female athletes on. I also see a lot of PTSD and trauma related to childhood trauma or to social relational trauma, meaning, past relationships with romantic past relationships. And then that sort of sometimes also affects relationships within the team. So there's a lot of issues associated with getting triggered sometimes by coaches when they say certain things maybe, or if a coach is not being super supportive of their feelings or their mental health, they may not feel safe. And so sometimes that becomes something that we are constantly processing through. So why is treating mental health so important? If mental health issues are left untreated, it can become medical issues. We can see poor concentration and lack of motivation. We do see social isolation, and we also see substance abuse. And then one of the most important things that we want to address always and make sure it does not happen is that when we don't address mental health issues, we can start to see people wanting to hurt themselves and can lead to some suicide behavior. So I just wanted to give you guys like an idea of some of the cases that I see. I have 2 de-identified cases to protect confidentiality, but these are actual athletes that I have worked with in my practice. So Gina is a high school student athlete. She had come to me for social anxiety, which turned into depression. That depression peaked during COVID, and then after she got a concussion, and the injury actually just created a lot more isolation and impacted her mood quite a lot. She actually copes with stress by pulling out her eyelashes and her eyebrows. Her sport is the #1 priority to her. She holds herself to a high standard. She did sign with a D1 university, but actually was not sure if she was going to be able to go because she was having so much constant panic attacks and just massive amounts of anxiety and depression. She actually did really well after working through some of this stuff for about a year or 2. And now is at her D1 school, and I still do talk to her actually, so yeah. Grace is was an Olympic gymnast. I should say she is an Olympic gymnast. You don't stop being an Olympian, right? And she had developed an eating disorder probably around 12 years old, we're thinking, mostly anorexia, but her eating disorder definitely got worse as she got older, and her childhood was spent with mostly host families. Going to the Olympics was the priority, and she received a lot of unhealthy messages about food and her body image from a lot of people in her life. There was constant monitoring, constant comments by the coaches, and she still suffers right now at 25 years old. She's been inpatient, hospitalized for her eating disorder a couple of times. She takes regular medication, and she does go seek out counseling every week so that she can maintain her coping skills and continue and not regress. Okay, so what impacts mental health? Athletes have a perfectionistic attitude or personality, right? Perfectionism is sort of just ingrained in them, right? And so they're always wanting to succeed and always wanting to succeed well. Sometimes that can create some stress and can create some anxiety and can create some depression, right? There's a lot of fear of failure to not perform well, fear of failure to lose your spot on the team. And then when their performance suffers, they do start to to get stressed out, and we start to see a lot of like anxiety and depression and dip in mood. Injury always is going to always have an impact on our mood and our mental health. There's just an inability to play, there's an inability to connect, especially if you have a concussion. There's a whole lot of different factors that play into having a sports injury. There's constant pressure on athletes to succeed, to do well. They also have a lot of high expectations either put on them from others or internal expectations that they put onto themselves. We know they have a demanding schedule, and then we also know that there's normal adolescent and developmental challenges, or even when we are working with adults, there's normal things that are going on in everyone's life that are just going to impact and affect our mental health. So this is kind of the picture that I always show everybody. It's kind of like there's all these things that they're juggling in the air, and they just don't know if they're strong enough. They just don't know if they have the skills that they need to cope, and they don't know where to go. So what are some signs that an athlete is struggling? You're going to see them withdraw socially. You're going to see sadness, depression, and anxiety. You're going to see hopelessness and anger and irritability and personality changes. In female athletes, you are absolutely going to see more social withdrawal and sort of depressed mood than you may see anger and irritability. You're also going to see maybe that they are engaging in some self-medication, some substance or alcohol use. You may see changes to sleep, eating, or hygiene, and again, you're going to see them withdraw. And there's going to possibly be some constant rumination of thoughts, always talking about the same thing over and over, and this all or nothing thinking, which is like, I'm never going to succeed, I'm never going to be successful. So what does that look like for you as an athletic trainer? This may look like an athlete missing or being late to practice, an athlete who's angry at their teammates or the coach for like no apparent reason. You may see a decrease in their performance. You may see their weight change or their appearance change. If you're in a school setting, you can hear that their grades are slipping or they're failing tests. You're also going to see some anxious or sad mood during practice, withdrawing from team functions, and difficulty concentrating in practice. So these are the things that I would say that you could look out for when you are working with your athletes to see and identify any at-risk students or red flags. So athletic trainers, you are important. You see the student regularly. You have information that other people do not have. You're present when an athlete gets injured, when they need rehab, when they're on the sidelines. So you have like a different communication and interaction with these athletes than anybody else does. You are viewed as a trusted individual. I hear all the time working with athletes how important their athletic trainers are to them. So I want you to know, first, that I thank you for all of your work that you do with athletes, but that you are important. So you can intervene and you can help support your athletes. Okay, so just a quick side note, I wanted to just address the patient health questionnaire. I'm going to try not to spend too much time on it, but this is new to us here in Arizona. This is a part of our PPE physical exam. We decided to put this in at the SMAC committee and the AIA just to sort of, again, have a screening tool for mental health, which is really great because now we're not just addressing the medical or physical side of the athlete, we're also addressing the mental health side of the athlete. So we're integrating both. This is a screening tool to screen for anxiety and depression. The first two questions, 1 and 2, are talking about anxiety, and the last two questions, 3 and 4, are talking about depression. So you kind of get a range of a score, but most importantly, what I want you to know is that if an athlete is scoring in the moderate or severe range, kind of to make sure that you want to flag those athletes and you want to get them immediate help if they need. So if they're in the mild range, you want to just, maybe schedule a check-in or always provide resources to them. And if they're in the moderate range, you want to follow up with questions to identify severity, right? How intense, how severe is this depression or anxiety that they're feeling? You want to provide interventions and resources, and then you want to flag them, right? You want to check back in with them for sure and say like, okay, this is somebody who I need to make sure I assess and see if they're doing okay in like a couple of days. And if they're scoring in the severe range, you absolutely want to get them immediate psychiatric and psychological treatment that day. Okay, so supporting the student athlete when mental health needs are present. What are you going to do? Just a quick overview. You want to express your concern. You want to tell them that, you feel like they've been a little bit different lately. Is everything okay? Feel free, please, this is a safe environment. You can talk with me. You want to provide a quiet space to talk to them. You do not want to talk to them in front of everybody. You also want to listen and provide validation and normalize their feelings, no judgment. Be empathic, so watch your words and almost let them talk. Silence is okay. It's all right to let them tell you their story. And if expressing any suicidal thoughts ever, you do not want to leave that person alone, and you want to get them help immediately. Okay, quick note about confidentiality. If you're working with minors, you are a mandated reporter, so make sure that you, if they are disclosing if they're disclosing that they're going to hurt themselves or someone else, or if someone is hurting them, you have to report that information, whether that's to school officials, parents, and crisis mobile team, or calling 911, or actually all of the above. Okay, so where to begin if your athlete is showing signs of a mental health emergency? A lot of schools in Arizona have mental health emergency action plans, and so I just want to talk a little bit about what that looks like and sort of what your role is and kind of how you can be prepared if there is a mental health emergency on your campus or on the institution that you work in. So you want to assess the student by asking some of these questions. Most importantly, did the athlete express harm to self or others? Does the athlete, say that someone's hurting them? Do they have access to a weapon? Are they using substances? Overall, am I concerned for this person's safety? Am I concerned that this athlete is not safe or is experiencing some mental health distress? If you said yes to these questions, follow these steps. So when risk is present, you want to first and foremost remain calm. You have to be able to be calm in order to help the athlete. You want to listen. Again, let them tell you their story, okay? Take your time. Let them take their time. This is hard for them to talk to you. You don't want to judge. You want to be empathic, and you want to provide support and validation. I hear you talking today. This has got to be difficult for you. I know this is hard for you to share this with me. Thank you for doing so. I appreciate you talking to me about what's been going on with you and your struggles. You want to keep you and others safe. So if the athlete you're assessing is at any point getting aggressive, you want to make sure that you keep people around you and keep you safe. So maybe getting other help and getting other support is perfectly acceptable. You actually want to assess risk and suicidal thoughts. So is there a plan? If they have a plan, if they are saying that they're going to hurt themselves, you don't want to leave the student alone, and then you want to absolutely get some support. You want to call parents if they're minors, and you want to always follow the crisis procedures of your school, campus, or your institution. If at any time you need other support and no one's around you, calling 911 is completely okay. And then after the event, you want to make sure you document all of the details so that you have that information. So if no risk to athlete safety is present, if they're, if you don't know if that they're, saying that they're expressing any harm to themselves or others or being aggressive in any way, and there's no risk there, you want to go through these steps, which is somewhat similar to what we just talked about. But you want to, again, offer a confidential space to talk, be empathic, provide support, and not judge. Remember, it's always about listening. It's always about normalizing their feelings. I understand how difficult that this must be for you. And you want to ask open-ended questions versus yes or no questions. So whenever you're trying to assess mental health or even understand what's going on with somebody, asking open-ended questions is way better than asking a yes or a no, yes or a no question. So saying, tell me a little bit more about how you're feeling versus are you feeling sad? You're going to get more information from the open-ended question. And then you always want to assess suicide again. You want to determine if there is a plan, and if there is, remember, do not leave that student alone or that athlete alone. You want to inform support team when you need to. You want to connect these athletes to referrals, right? Whether that's that's on your campus with mental health professionals or outside of your campus with mental health professionals. Calling parents if they're minors and if you need to. You want to thank the student. This took courage to talk to me. Thank you for sharing your story with me. There are people here that want to help you and that can help you. Let's go find them. And then bring them to those people who can help and support them more. And then again, you want to always document these events. Okay, so NCAA also has best practices for mental health. I'm not going to go too much into this. You can see the slide here. But basically, they're saying that we want to have an environment that promotes positivity, resilience, and support of mental health needs. And that it's really important to use screening tools and to get athletes to the appropriate people and the appropriate referrals when there's a mental health emergency. Okay, and just really quick, I'm not going to go too much into this slide either, but things you should know. On your campus, if you're working in a school, or even if you're not on a school campus, some of the most important things you should keep in mind is what is your emergency action plan for mental health? Do you have one? If you do, find it and be familiar with it. If you don't, maybe it's a conversation you can bring up to your supervisor saying maybe we need to think about creating one. Know on your campus, if you're in a school, where the school counseling department is, where the mental health facility is, if you're in a university, or even at like a private, work environment. Do you have any resources that, you can refer people to that you see, and get to know those people. Call them up, stop by their office so that when you refer athletes to them, it's, you're having sort of a relationship already. It's not that you just met this person for the first time. One of the things I also always say is get to know your athletes. If the more you know them, the more you know their personality, the more likely it is that you're going to know when something's not right. And if you have athletes who are minor athletes, you might want to get to know their parents too, so that when or if you have to make a phone call to them, it's not a surprise and you've already had at least one conversation with them. Also, just make sure you know who to contact after hours if you have an emergency on your campus and you're alone, right? And then also talk about mental health regularly. Make it a thing so that it reduces the stigma. Okay, so I just wanted to give you a couple of real life situations to think about how you would handle some of these situations. They are real life situations, so people have actually had these challenges with some of these things. So an athlete informs you that they are suffering from anxiety, they are seeking professional mental health counseling, but because of confidentiality, you are not able to disclose this information to the coach. The athlete will be missing a few upcoming practices due to doctor's appointments and because of the anxiety. What do you tell the coach? So you can't disclose that the athlete has anxiety because that's private information unless the athlete actually talks to the coach themselves. But you have to tell the coach, hey, the athlete's going to be missing some practices and they are going to be excused for those next 3 practice times and that it's okay. They have a legitimate reason. You also may want to talk with the coach or tell the coach that the athlete should not be penalized for missing some of these practices because it's a real actual reason to be missing the practice. And then I would always say to start opening up communication with the athlete about their anxiety and how to talk to the coach. It's really much better when everybody's on the same page versus sort of kind of hiding certain information. And the head coach needs to know a lot of things, but we want to have the athlete be able to have those kinds of conversations and facilitate a more safer, comfortable environment that promotes, mental health support. Okay, so another situation is that an athlete tells you they have not been feeling like themselves since they had a sports injury and are feeling down, have zero motivation, and don't really have much of an appetite. They tell you that they are sad a lot of the time, they're bored with school, they haven't been socializing with their friends, and they're feeling isolated from the team. what are some things that you can do when you are seeing some of these red flags? You want to go through steps of your emergency mental health action plan. You want to identify if there is risk involved. So you want to talk with the student in a quiet, safe place. Remember, always getting the student alone in a quiet environment is always helpful for them to open up. And you want to ask open-ended questions. Normalize those feelings and show empathy. So a couple of things you can, some statements here that you can use is, thank you for sharing with me today. Tell me more about how you are feeling. I know sometimes when we aren't feeling great, we may have negative thoughts about ourselves. Have you ever had thoughts about hurting yourself because of the way that you're feeling? I know you want to feel better, and I know you want to feel more like yourself. Why don't we go talk to someone who can help you feel better? Okay, so the AIA has a website. Check it out. There's a lot of mental health resources on that website. I think it's something you can bookmark and you can kind of go to for referrals for your athletes. These are just a couple of mental health resources. They should be on the AIA website, but if they're not, take a quick picture of this. But these are some great resources that you can have and refer back to. And then I think everybody's aware of this now, but the 988 is the 911 of mental health right now. It came out in July of this year. And so if you are ever experiencing a mental health crisis with an athlete, or you can give this number to your athletes to tell them that if they're ever experiencing a mental health crisis, they can call 988 like they would 911, and a trained professional will be able to talk with them or with you about how to help support an athlete or a person in general. Okay, so best ways to support your athletes. We want to listen. We want to create an environment that promotes openness, safety, and communication. We want to collaborate with others, and we want to support the mental health needs of the athlete. We want to be an advocate for our athletes so that they can get the support and the help that they need all the time. And then I just want you guys to remember, mental health does exist in our female athletes. It's important for us to remember that, they're not just resilient to all struggles that they're going through, and that they will open up if they have a safe environment. So be ready. Be ready for a female athlete to come and talk with you when they are in need. Follow best practices and safety plans from your agency and the place that you work at. And then also get help if you need it, right? Talk with other people. Get support when you need support as well when working with these athletes. Remember, it's our job to protect, and it's our job to support and advocate for their mental health needs. And I just wanted to say thank you so much for listening to my presentation today.